Now, in terms of clinical trials at the NCI specific for neuroendocrine tumors, either the patients or the referring physician is referred to us. We collect the clinical information, we collect pathology, we collect imaging reports, we review all that information. We have a team here that specializes in neuroendocrine tumors, from surgical oncologists, medical oncologists, endocrinologists, nuclear medicine, radiation oncologists, and so forth. Once we review all that information, then we provide an opinion to the patient as well as the physician. The patient can then be enrolled into the data collection of clinical care and interventions in the Clinical Cancer Research Center of the NCI. And that also this protocol allows also for patients to have surgical interventions as well. If a patient that is coming to the clinical center and surgery is indicated, patients will be able to participate in the study, the clinical care. Moreover, we also offer other studies that the patients can be co-enrolled as well. And in this case, the natural history study for neuroendocrine tumors also allows to enroll patients and follow patients over time. This protocol also allows me to see patients that are not eligible for surgeries, and Dr. Hernandez will discuss more in detail about his research and patients that are eligible for surgery. And as we know, patients with neuroendocrine tumors, even in the metastatic setting, surgery is still considered an option. And if you wanted to learn more information, LACNETs also have a series of videos and webinars and recorders that you can obtain more information about when surgery may be indicated in this situation. And Dr. Hernandez will discuss more in detail about his exciting research. Now, if the patient is not eligible for surgery, then the patients can be enrolled on my study. And also, if the patient requires treatment too, right now, we have a treatment trial of Lutathera. We know that Lutathera is approved for the management of neuroendocrine tumors in combination with a pill called olaparib. And the idea is to make Lutathera more effective, and that's for patients with gastric and pancreas neuroendocrine tumors. We're currently enrolling those patients into the study. And we're also opening more treatment studies for neuroendocrine tumors as well as for neuroendocrine carcinomas within the next few months. Also, there's multiple clinical and treatment trials available at the NCI, and working together with your referring physician, we can find other treatment options available for your tumor type. Once the patient is eligible for surgery, patients can enroll in different protocols, as we discussed earlier, including the natural history study for neuroendocrine tumors. Dr. Hernandez is our super surgeon expert in neuroendocrine tumors. He specializes in complex general surgical oncology as well as hepatopancreatic biliary surgery. And once the patient is eligible for surgery, there is going to be a piece of tissue taken for different research goals. And Dr. Hernandez, as I said earlier, the reason of this webinar is to discuss the exciting research of Dr. Hernandez and his team, but also my team in the developmental therapeutic branch. We're also working on different research aspects of neuroendocrine tumors to be able to develop models and develop novel therapies for neuroendocrine tumors, as well as to understand the genomic signatures and correlate with treatment response. And then this research may be a discussion for another time, but more importantly is to see what Dr. Hernandez has to share today after me. Now, if you have any questions, please contact us for help. You can see that there is different ways to contact, like via phone or live chat, or also via email. You can contact me directly through my email. This is my email. And as I said earlier, if you have an interest to be seen at the NIH, we collect all the information. You can send me an email directly to be able to collect all the information, and then we'll review and we talk with Dr. Hernandez as a team. I have to say, I'm very fortunate here to be at the NCI, to be able to do the research that I love in neuroendocrine tumors, and to be able to work with fantastic researchers that wants to improve the quality of life of neuroendocrine tumors, such as Dr. Hernandez. With that, I would like to thank the LACNETs team, Ms. Lisa Yant, Ms. Heather Davis, Ms. Mary Dunleavy, Donna Gavin, and Kavya Velagapudi, as well to continue the legacy of Ms. Giovanna Imbesi, who has dedicated her life to improve the life of patients with neuroendocrine tumors. you.